Anastrozole is a medication that is classified as an aromatase inhibitor. It is used to treat hormone receptor-positive breast cancer. Aromatase inhibitors are one type of hormonal therapy that is used to treat breast cancer, particularly in postmenopausal women. Their main role is to reduce the estrogen levels, which can reduce the growth of breast cancer cells. Among the aromatase inhibitors, you can find medications like anastrozole, letrozole, and exemestane. Higher estrogen levels, especially after menopause, are linked with increased risk of breast cancer. Anastrozole is effective in reducing the risk of breast cancer recurrence and improving survival in postmenopausal women. In the premenopausal women, the use of anastrozole is ineffective. This video covers the important information about the anastrozole, like how it works and what important precautions should be considered. How to take this medication and what are the common side effects. First, let's see how this medication works. Anastrozole blocks the action of the enzyme aromatase. This enzyme is responsible for converting the androgens into the estrogen in the fat tissue. It is also known as estrogen synthase. That means this enzyme is responsible for the synthesis of estrogen. It's one type of cytochrome P450 enzyme. It catalyzes the production of estrogens like estrone from the androgens. Aromatase is expressed in various tissues, in the female ovaries, brain, adipose tissue, and skin. Apart from estrogen synthesis, it is also responsible for brain development, neurogenesis, and neuronal activity. After menopause, estrogen production is going to be reduced. The primary source of estrogen in such women is derived from the fat tissue. During a menopause, the egg production from the ovaries is gradually reduced. Therefore, the production of estradiol declines significantly. To replace this estradiol, estrone is going to be produced. After the menopause, this is derived from the androgens produced in the fat tissue. The amount of fat tissue in the body influences the estrogen levels, as fat cells convert the androgens into the estrogen. These fat cells are expressed with aromatase enzymes. This enzyme converts the testosterone into the estradiol. Similarly, it can also convert the androstenedione to estrone. Estrogen receptors play an important role in the development of breast cancer. Particularly, they can produce hormone receptor-positive cancers. That means here estrogen can bind to these estrogen receptors, which can promote cell growth and uncontrolled proliferation. This also results in the loss of function, leading to the development of breast cancer. Around 70 to 80% of breast cancers are hormone sensitive. That means their growth mainly depends on hormones like estrogen and progesterone. These cancerous cells are going to express the estrogen receptors. Estrogen receptors are of two types, alpha and beta. Estrogen receptor-positive cancer cells mainly express the alpha type of receptors, which are mainly responsible for cell proliferation. When estrogen binds to these estrogen receptors, it can trigger a few of the events that increase the cell division and growth. Therefore, it is highly essential to reduce the action of estrogen on these estrogen receptor-positive cancerous cells. Hormonal therapies are effective in treating these ER-positive cancers. Anastrozole mainly acts by reducing the estrogen levels. Thereby, it can reduce the action of estrogen on estrogen receptors. A few of the cancer cells are also termed ER-negative. That means these cancer cells do not express the estrogen receptors. Due to a lack of estrogen receptors, they are not affected by hormonal therapy. Therefore, it is highly essential to determine whether the cancerous cells are either ER-positive or negative before starting the therapy with anastrozole. Now let us see how to take this medication. Anastrozole can be used as a first-line treatment for the treatment of breast cancer in the postmenopausal woman, particularly in hormone receptor-positive breast cancer. It can be started at a dose of 1 milligram every day. The treatment can be continued until tumor progression. It can also be used as a second-line treatment for advanced breast cancer in postmenopausal women, following tamoxifen therapy. However, if people are not responding to the tamoxifen therapy, use of anastrozole is ineffective. It can also be used as an adjuvant for the treatment of hormone receptor-positive early breast cancer in postmenopausal women. As an adjuvant, it can be again given at a dose of 1 milligram per day, up to 5 years. Now let us see the precautions. Anastrozole can increase ischemic cardiovascular events. Therefore, if you have any pre-existing ischemic cardiac disease, it may increase the risk. This may increase the risk of heart attack and stroke in the woman. On long-term use, It also increases the risk of heart failure and the development of arrhythmia. This can be observed when anastrozole is used for the above 4 years in women with pre-existing ischemic disease. Use of anastrozole can affect your bones. It can reduce the bone mineral density at the lumbar spine and total hip bone. This may increase the risk of fractures and even the development of osteoporosis. Therefore, simultaneous use of bisphosphonates may be useful in patients with a risk of fractures. If you have pre-existing low bone mineral density, anastrozole should be carefully used. This condition is called osteopenia. It increases the risk of developing osteoporosis while using anastrozole. In such cases, your bones are more fragile and easier to break. This may increase the risk of bone fractures. Osteopenia is developed due to any deficiency of calcium and vitamin D, or it may also be due to genetic factors and hormonal changes. Therefore, proper precautions should be taken to maintain the bone mineral density while using this medication. Anastrozole can elevate your serum cholesterol levels. Therefore, try to monitor your cholesterol levels regularly while using anastrozole. Before starting the therapy, if you're having elevated levels of cholesterol, you should use this medication very carefully. In people with hyperlipidemias, the risk of elevated serum cholesterol may increase cardiovascular events. Now let us see the side effects of this medication. One of the common side effects of anastrozole is the hot flashes. It is one of the uncomfortable experiences in women that results in a sudden and intense sensation of heat. It may affect your neck, face, and chest. It may be associated with sweating and chills. In a few people, it may also result in anxiety and rapid heartbeats. Anastrozole can induce joint pain and muscle pain. You may feel tired and weak. You may also have mood disturbances. A few other side effects, like elevated blood pressure, pharyngitis, skin rashes, and osteoporosis, can also be observed. It can induce bone pain. In a few people, accidental injury and fractures may be possible due to low bone mineral density. Where is it not suitable? Anastrozole is not indicated for the treatment of breast cancer in premenopausal women. In such women, it is ineffective because ovaries can produce estrogen. Anastrozole can produce fetal harm or even loss of pregnancy. Therefore, it is contraindicated in women who are pregnant or may become pregnant. If you develop any hypersensitive reactions like skin rashes and swelling of your throat and lips, use of this medication is not recommended. Drug interactions. While using anastrozole, you should avoid estrogen-containing therapies because they can reduce the effectiveness of this medication. Anastrozole works by reducing the levels of estrogen production in your body. If you're taking estrogen-containing therapies, the effectiveness of anastrozole may be reduced. Therefore, try to avoid estrogen-containing therapies. Taking anastrozole along with tamoxifen is not beneficial. Instead, it may reduce the levels of anastrozole in your body. Therefore, tamoxifen should not be administered along with anastrozole. In postmenopausal women with advanced breast cancer, tamoxifen can be used to produce disease progression. In such people, anastrozole can be used as follow-up therapy after tamoxifen. That's all about this medication, anastrozole. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.